Hey there, it's Clara from AcuPro Academy, and today's video is all about TCM diagnosis and especially the inquiry method. And we're going to apply it on the lung system. So there is no wrong treatment in TCM. As you know, there's only the wrong diagnosis, and it's probably the hardest part of TCM. So I have this whole series on inquiry. You can check the heart system and all the other system on my YouTube channel for sure. And if you want more, there's a ton more on acuproacademy.com, my website, with tons of videos and blog posts and PDFs and treatment protocols. So check it out and let me know what you think. In the meantime, let's start with the lung system on this TCM diagnosis inquiry video made easy. So before we start talking about diagnosis, it's always good to go back to foundation. My Chinese medicine teachers used to tell me all the time, if you can't understand something, go back to foundation. It's called foundation for a reason, right? So the lung functions in Chinese medicine, that's part of foundation. So let's just review that quickly. So we are in the lung system and we feel like we're back in the foundation. So the main function of the lung in Chinese medicine is, of course, to govern qi and respiration. It's in charge of breathing in oxygen and breathing out CO2, of course, or breathing in good air qi and expelling bad air qi. It's also, of course, in control of the immune system, or the wei qi, the defensive qi, so allow us not to get sick and to fight pathogens. It opens into the nose, so if there's nasal issues, we have to look obviously at the lung. It controls the skin on the body, obviously the whole skin, and the body hair. So the body hair is great because it's a defense mechanism, right? That's why we have body hair. I know a lot of people don't like to have body hair, but it's a defense mechanism. It's very important for a purpose. If we have nose hair, it's for a purpose. It stops pathogen and particles from entering the nose, right? There's purpose for everything in our body. It's an amazing machine. The lung controls the skin, so if there are skin issues, specifically allergies and reactive to the environment, that would be related to the lung defense system, right? The lung is also in charge of regulating water metabolism, not by itself. It does this with the spleen, the kidney, and the sanjiao. So as a lung function, it really takes the water and distributes it to the skin and to the outer layer, so we have a nice looking skin and not dry. The lung is also in charge of controlling qi in all the meridians. So often when I teach acupuncture, we always start with the lung meridian. Not that we have to, we can start with any of them, but it is because it controls qi in all meridian. And the last one is the lung is in charge of housing the mind and body connection. A lot of people are not aware. They have a disconnected part of their mind with their body, right? There's no awareness in their body. That's a problem with the lung. So being able to connect the mind and the body, that's a strong TCM lung system. So let's start it up with diagnosis. When someone comes in and I want to go through the questionnaire, because this is all about inquiry, I start to look to see if there are lung qi deficiency. If there's lung qi deficiency, people are going to say yes to, do they have breathing difficulties, right? Shorter breath. They can catch their breath. They can't breathe deeply or inhale deeply. It's short, right? Like people that have asthma can't take a big deep breath, specifically if they're having an attack. Do they have sleep apnea, right? Are they aware, or do they have sleep apnea? Are they short of breath, like I said? Do they catch colds and flus easily? Because, of course, that's the immune system, right? Do they get sick easily? But also, maybe they don't catch a lot of colds every year, maybe 2. But it takes them like 3 weeks to 4 weeks to a month to shake the cold. That's the same idea, right? So do they catch them? And do they last longer or linger? That's also would be a lung qi deficiency. Do they have environmental allergies like dust and mites and pollen and dander from animals, like anything from the outside that really makes you sneeze and makes you really maybe, break out in rashes, itchiness, etc., etc. And of course, is there a skin issue that is chronic, like eczema, psoriasis, acne? Skin is or dermatology is a very complex part of our system, and it's not just affecting the lung. But it's always good to see if there's a connection with someone that, let's say, has asthma and eczema, because those two are very much going to be affected by stress and are very much related in the defense system. So let's look at differentiating a little bit. So if someone catch cold easily, it's a LUNG Qi deficiency, like we just saw. All those symptoms are LUNG Qi deficiency. If someone has environmental allergies, that is a LUNG Qi deficiency. If they have tendency to have more food sensitivities, that is a spleen Qi deficiency. So a lot of time people that have food sensitivities have also some kind of environmental allergies. So often it's a spleen and LUNG Qi deficiency because spleen is part of the earth element, and the earth generates metal, which is the lung element. So spleen, or a good digestive system, always generates a good immune system. Very important to put those two together. Someone has sleep apnea. So sleep apnea, again, can be quite complicated, but in general, it is a LUNG Qi deficiency and a kidney Qi deficiency. Some people have sleep apnea are diagnosed later on in life when they're older, when their kidney starts to be depleted. Also, it's usually due to phlegm. For a lot of people, if they have a lot of excess weight, specifically a lot of excess weight in the upper body, that creates a lot of pressure and phlegm, and that allows them not to be able to breathe properly at night and, have sleep apnea. Anybody that has shorter breath, can't take a breath, is definitely LUNG Qi deficiency. So the breathing ability, the allergies, and catching cold easily, those are all LUNG Qi deficiency symptoms. It's pretty simple because it goes back to foundation and the lung function as a TCM organ system. So to kind of give you an idea, when we have someone that has LUNG Qi deficiency, if we look at the symptoms, of course, fatigue is one of them because it's a Qi deficiency. Weak voice, because the strong voice, you can hear my voice pretty strong, that is a good strong lung. If people have a really weak voice and they can't even talk because it exhausts them and they have to take a breath every time they take a sentence, that's a weak voice, that's a depleted LUNG Qi. Shorter breath, of course, catching cold easily, we said that, the allergies that are environmental. Also, for some people, it may be that they cry often and they're depressed. But again, depression can be many, many things and not necessarily just a LUNG Qi deficiency. Pale tongue and a weak pulse. Great thing to do for LUNG Qi deficiency. First of all, it's to restrict milk dairy product, because that's going to create more mucus and restrictive function of breathing in the lungs and the bronchi. So we don't want a lot of phlegm. So we don't want dairy because they are forming phlegm or mucus forming. So having said that, the broccoli is great, cooked broccoli specifically, because broccoli looks like a lung, right? You can look at it. Kale is really good, the mustard green, so all that kind of family. Garlic is great because it strengthens the body to fight pathogens. So that's also quite well done. And apples and pears are also good for the lung, because the lung is a metal element and metal is in the fall. And apple and pears are obviously a seasonal fruit that is found in the fall, even though we get seasonal fruit all year long in our Western world most of the time. So let's do the differentiation of the lung patterns. Those first three lung patterns in TCM diagnosis are acute issues: wind cold invasion, wind heat invasion, and wind damp invasions. So often this could be a cold or flu or some kind of, feeling sick for a little bit. It's not too bad. So the first one is the person may start with an itchy throat or, tickly throat in the morning. Maybe they start coughing a bit, not always, but they definitely going to start sneezing a lot, and eventually maybe have runny nose, specifically with clear watery mucus, because that's the cold. Their aversion to cold, or they feel chilly, right? Like when you start getting a cold, your body is aching. You may have an occipital behind of the neck, tension, headache kind of thing, and you feel cold and you don't like the cold, and then you feel like you're sneezing a lot and you started to have a runny nose, and then you get sick or you have a cold. So the pulse usually is floating because it's on the surface, because the pathogen is still external. It hasn't penetrated deeply in the body. So hopefully your body can fight it. And the tongue usually is normal unless there's other patterns that are underlying here already from, a normal chronic issue. And then we have a thin white coat. So the thin white coat represents the excess cold invasion. With wind heat, it's the same idea, but it's more fluish like symptoms. So the sore throat is much more pronounced. There may be some cough, again, maybe not always. But if we have runny nose or stuffy nose, it would be with yellow mucus. That's more the heat, right? We would be thirsty because, again, we're thirsty because there's heat, and a little bit of fever, slightly sweating. We still have a bit of chills, right? We don't feel right, and we feel maybe headachy. Specifically, this headache would be more of a frontal headache, like in the forehead, right? So that would give you the wind heat. Floating, but more rapid pulse, because now you're a little heated, right? So you have a bit of a fever. The tongue would have a thin yellow coat. It may be red, but it's not always the case. It depends on how much heat the person or feverish the person has, right? And wind cold can turn into wind heat and vice versa. This is very common, right, in TCM? Wind damp. Again, this is an acute issue. This is more an allergic reaction to something, or suddenly the eyes and the face starts to swell. Maybe the throat, the eyes, the face. The body starts to swell and it spreads rapidly all over the body because there's wind. Remember, wind is the pathogen that always comes with a body, never comes by himself, and basically is the one that changes and moves things rapidly, just like outside, right? So the wind moves everything rapidly all over the body. The person is kind of like shiny complexion at the time. They have scanty pale urine because, of course, they're not peeing a lot because they have water retention from the sudden swelling. So that's an allergic reaction usually. And so the pulse would be floating and slippery. Of course, floating because it's still an external pathogen, and slippery because of the dampness. There would be a white, wet coat, probably wet or greasy coat depending, but probably very shiny coat. So those, again, are acute and pathogens invasions. The next two, so those two are interesting because they can both be specifically phlegm, heat in the lung. That's an excess pattern that could be chronic or acute. So phlegm, heat in the lung could be a chronic, let's pick a disorder like a chronic bronchitis or an acute bronchitis, right? So the phlegm is going to show up as profuse phlegm. So the person is coughing yellow, thick, smelly kind of phlegm, gross, but they're barking cough. So a barking cough is a cough that's really loud, like whoa, whoa, like, like a smoker's cough or someone that's really, really loud and they're coughing because it's excess, right? And they would be short of breath because, of course, it's impairing the breathing. Some people that have asthma, that would come up as phlegm heat when they have an attack, maybe. Not everybody has that, right? Not every asthmatic patient has phlegm heat, but you could have that. And feeling stuffiness in the chest, of course, because there's phlegm. The heat comes up as the yellow in the phlegm, for sure. And the person's probably feeling quite warm in general. So again, this could be acute or chronic. If it was chronic, the pulse would be rapid and full. That's the excess heat, and slippery for the phlegm. The tongue is red, which is heat, and the thick, sticky or greasy, which is the phlegm, yellow, which is the heat coat. Okay, so sticky yellow coat represents sticky, the phlegm, and yellow, the heat. Now, if it was more acute, the pulse might be a bit more floating, specifically in the lung area. Okay, phlegm fluids in the lung. So this is usually, again, someone that could be acute or chronic. If it was acute, the pulse, would be much more floating. But if it was chronic, the pulse would be much more weaker. So it is slippery no matter what because there's excess fluid and phlegm in the lung. But the pulse would be either more weak or more floating, depending if it was acute or chronic. The person would cough, and you could hear splashing sound in their chest area because they have a lot of fluid in there. They're short of breath, of course. They may be vomiting the fluid as well, specifically vomiting and coughing white, watery, foamy kind of sputum or phlegm, right? So very watery, foamy kind of phlegm. And they feel kind of a bit chilly, even though it's not a cold. They are going to be on the chilly side because definitely that could be the next step. The tongue is pale specifically if it's a chronic issue. If it's acute, not necessarily. It's the thick, sticky or greasy white coat, right? So definitely greasy, sticky because that's the phlegm and the fluid. And the white represent the cold. So again, cold usually invades with the phlegm fluid when it's excess like this, but it's not a major part of it. So I would still warm the person up in the treatment principle. Let's look at deficiency patterns. So we've already looked at LU Qi deficiency. So let's compare yin deficiency, fluid deficiency, and LU Qi deficiency. So with LU Qi deficiency, we know what happened. We catch cold easily. We have environmental allergies. We're short of breath, right? And fatigue, of course. With LU yin deficiency, the cough is very dry and it's chronic. Sometimes if someone has smoked for 40 years, they may have a little bit of phlegm or blood in the phlegm, but mostly it's a dry cough. The person feels hot most of the time, like that low-grade fever means the person feels hot in the afternoon or at night mostly. They may have night sweat or just feeling hot at night, and they probably cough worse at night. So they have to kind of sit up propped up, because if they lay down, the cough is worse, right? They usually have coughed for many years, so their voice is very hoarse, kind of like this. My mom was a smoker for 60 years, and so her voice and her vocal cord had completely changed and became much more deeper. So I'm used to that, and I could tell you I'd never smoke, ever, because I saw the ramification of smoking. The person is yin deficient, so they might have red cheeks, dry skin as well, dry mouth, and dry throat. Specifically at night, they need to drink water. They have dry throat or dry mouth. The pulse is a thin, rapid pulse, which is a yin deficiency sign. And the tongue is red and cracked and peeled with no coat. Okay? So very different from the LU Qi deficiency, right? You can see the difference. With lung fluid deficiency, or lung body fluid deficiency, it's all dryness, right? So dry skin, because of course, lung is in charge of skin. So the skin is very dry. Dry cough. So this is a dry cough that starts to really irritate the bronchiole, because the person's coughing a lot for a long period of time. And so it's really irritable because it's so dry, right? And then dry throat, dry mouth. And of course, thirsty as well, because of course, this person is body fluid deficient, right? So with that, we need to hydrate and lubricate, meaning we need lots of fluid, but we also need lubrication, meaning we need to have vitamin E food, vitamin D food, right? So making sure we have a lot of good fatty food like avocado and nuts and seed, etc. Of course, there's a dry coat on the tongue or no coat that's very cracked, or depending on the degree of body fluid deficiency invading the lung. And it's a deficiency, so the pulse is pretty weak. So that's pretty simple. The last two are a little bit different, and those are a little bit harder to explain when I teach to my students. So the first one is kidney failing to receive LU Qi. So if you remember from the kidney function in foundation, one of the function of TCM kidneys in foundation was to receive LU Qi and be able to grasp it. So the idea is the relationship between lung and kidney is when you take a big deep breath, deep breath all the way down to your belly button, you are increasing your lifespan because you're doing big, deep breathing exercise, which helps the kidney stay strong because it's our aging system, right? So that allows for the kidney to grasp that oxygen that you breathe deep all the way to the belly button. And that allows the kidney to preserve its function in aging. So the whole point of this is that deep breathing exercise preserves our kidney better. So it's important to practice deep breathing exercise. A lot of people that have already chronic disorders like asthma have a really difficulty in inhaling deep, right? So someone with asthma is already kidney and LU Qi deficiency, specifically if they've had this since they were a child. So that's very difficult. We can manage the problem specifically with diet and acupuncture and other lifestyle changes. But if someone does not have the ability to breathe, inhaling deep, they need to practice that, right? Because that is obviously going to deplete the kidneys. But if the kidneys can't receive LU Qi, that means that there is a LU Qi disorder that's been there for a long time. So the person could maybe have asthma due to smoking, due to inhaling, due to was born with it, whatever the reason is. So rapid, weak breathing, which is with the difficulty in inhaling, right? Like that, like cannot take a breath. the person usually feels cold because it's going towards a yang deficiency. That's why there's usually swelling of the face, sore back, that's a kidney issue. Clear urination during asthma attacks. So this is a kidney yang deficiency that's starting to show. Right now, it's only a kidney qi deficiency, but it's going to go towards a kidney yang deficiency, and that's why we have cold limbs, specifically cold lower limbs. So the pulse is weak on both the lung area and the kidney area on the right side, so front and back, deep, deep, deep on the kidney position, and very tense because there is cold in the body now. The tongue is pale at this stage because it's a qi deficiency, but eventually it might swell and have a bit of a wet coat if it turns into a yang deficiency. Because there's always a degree, right, and a progression to everything. So obviously we don't want to progress to the bad side. We want to progress to try to regress or go back to not being sick. The last one, very, again, relationship with kidney and lung, is water flowing back to the lung due to kidney deficiency. So again, this is really that connection with the lung and kidney. So this is someone that would have probably a disorder like emphysema. It's a long. It's been a long time since someone has had this disorder. It could be emphysema. It doesn't have to be that, but has had issue with the lungs, okay, like asthma or emphysema, and it's been a long time. So now it's affecting kidney and lung very much so, in a way that the water, because the kidney and the lung are both in charge of water metabolism, is flowing back. So this is really, we have a lot of thin, watery, frothy, again, fluid in the lung. So we actually can hear the splashing, kind of like the phlegm fluid in the lung we had earlier, but this has been going on for so long that it's depleting both the lung and kidney. So a person can't breathe very well. They also have edema of the legs and ankle. That's a kidney yang deficiency that's happening already. Sore back, that's a kidney deficiency. Cold body, that's a kidney yang deficiency. And scanty clear urine. Again, this is the water metabolism not happening because there's not enough fire in the kidney to be able to do so. Plus, there's a lung issue that's been there for a long time, right? So we have a deep, weak, and slow pulse because, again, it is a lung and kidney yang deficiency. And then the tongue is pale, swollen, with a white, wet coat, depending. Sometimes it's wet, sometimes it's white, depending on what's going on. But that gives you an idea of all the possibility for the lung patterns. The one I see the most in my practice, and I think most people do, is the lung qi deficiency because that's very common, or the acute external pathogen invasion. I hope you really enjoyed this and it made sense and it helped you grasp the inquiry method for the lung system, so it makes it easy. The only point of my videos is to make it easy to understand and grasp without going too much in depth, just to really grasp the concept. Then we can go more in depth. If you love this, please subscribe to my channel so you don't miss my video. Leave me some comments, send me some love. I love to hear from everybody in this community. Follow me on Facebook if you want to. I post every single day at 6 p.m. And I'm on Instagram, AcuPro Academy. Lots of Instagram stories. Great fun there too. I have a great amount of TCM rock stars that are really connecting with me there and that I connect with. And I love how TCM has no boundaries. And of course, enjoy my YouTube channel and watch all the videos that you think are really important for you to grasp and get a better hold of Chinese medicine. And no matter what, keep rocking it using TCM.